Hello, good evening, everyone. My name's Louise Regan. I'm chair of the Palestine Solidarity Campaign. Apologies, I'm joining you from my car, but I'm just travelling back from a conference where I've been speaking. So welcome to tonight's webinar. This has been organised by Palestine Solidarity Campaign, with the largest main organisation in the UK and Europe, organising around solidarity with the Palestinian people. And obviously that is vitally important at the moment, because we know that Palestinians are going through, the darkest of times. We're also the key organisers of the mass protests we've seen in the UK since October. We've been taken to the streets regularly. At our largest, we've had close to 1 million people on the streets, but several 100,000 every time we have a national demonstration, but obviously huge actions as well up and down the country in other cities. And last Saturday, we had over 250,000 in the streets of London to mark the Nakba. And we know that the Nakba was not a one-off event. Palestinians have suffered a continuing Nakba since 1948, and we are seeing that played out in front of us in what is happening in Gaza right now. We have 15 trade union affiliates and hundreds of local and regional affiliates, including Unison, whose president, who will be speaking tonight, has spoken and has spoken at many of our national demonstrations in the past few months. This webinar is part of a series. Part 1 was on the arms trade with Israel. Part 2, we did a webinar on workers in the education sectors in Palestine, and both of those are available to watch on the PSE YouTube channel if you weren't able to catch them. These webinars are designed to highlight the situation for workers in Palestine and to present the voices of Palestinian trade unions to the UK trade union audience. And we know that trade union solidarity is vital now more than ever. And our trade union partners in Palestine have made very clear that what they need from the trade union movement here in the UK is solidarity, not just through our words, but through our actions. So it's really great that we have got this panel tonight looking specifically at Unison, the work they're doing, but also at what is happening in the health sector in Palestine. So we've got some fantastic speakers lined up for you. So please do stay to the end to hear all of them. And I'm going to hand straight over now to Libby Nolan. She's the president of Unison. As I say, many of you will have heard her speak. It's really good that you could join us tonight, Libby, and the floor is yours. Thank you.
And thank you for inviting me to speak. It's a great honour to march with you, to speak on the platform, on the PSC platform, and a great honour to be here tonight. Palestine has always been an international priority for Unison. We were amongst the first union in Europe to respond to the Palestinian call for boycott, divestment and sanctions. We have consistently called for an end to the occupation and for a viable Palestinian state, and campaigned for human and workers' rights and the right to quality public services. For the last 7 months, and it seems unreal now that it has been 7 months, we've been demanding an immediate and permanent ceasefire and full access to humanitarian assistance, as well as an immediate and safe release of those hostages. As the largest health union in the UK, as well as the largest union in the UK, we have, of course, placed a huge emphasis on the right to health over the last few months. Whilst Palestinians across Gaza continue to be bombed and starved, healthcare is largely destroyed in Gaza, which was already on the brink of collapse long before the 7th of October, due to the tight land, sea and air blockade and chronic underfunding. They were constantly faced with major shortages of the most basic of medical supplies. Those requiring specialist treatments were dependent on receiving a difficult-to-obtain permit from the IDF to access Palestinian hospitals in East Jerusalem. Now over 70% primary healthcare centres are not functioning, and just 15 hospitals are partially functioning. Yet they've been responding to close to 80,000 additional reported injuries and a huge surge in infectious illnesses and diseases caused by overcrowding, a lack of clean water and sanitation, and malnutrition. According to the World Health Organization, there are 760,000 cases of acute respiratory infections, 410,000 cases of acute diarrhea. This is only set to get worse as 81,000 people have once again been displaced from Rafah and are now seeking shelter on an even smaller area of land. I cannot begin to imagine the daily trauma of working in these circumstances for my fellow health workers, fighting to save lives when they know that their own lives and those of their families are under constant risk. At least 493 health workers have been killed, 130 ambulances destroyed or damaged, and healthcare facilities decimated. An immediate and permanent ceasefire is, of course, a prerequisite to the right to health in Gaza, as it is an end to the blockade and the occupation. And it's important that trade unions continue to play a leading role in a rapidly growing movement demanding that ceasefire, but also demanding workers and human rights and a right to public services, including health. We're proud in Unison to support both national and local protests to demand a ceasefire and to defend the right to peaceful protest when it comes under attack. On the right to health, we've supported and encouraged our branches to support the emergency appeals of medical aid for Palestinians and the Red Cross, and taken action to amplify health workers' demands for a ceasefire, both at health worker vigils and our own conferences and events, and we will continue to do that. We've issued regular statements highlighting our demands, including for a permanent ceasefire and the right to health, but also the demand for the UK to take action by suspending the UK-Israel Trade and Partnership Agreement and the arms trade until human rights are respected. They must also resume and increase funding for UNRWA, a major provider of healthcare for refugees, and it's outrageous, absolutely outrageous, that they continue with this devastating suspension of funding, despite the implications for Palestinians, not just in Gaza, but in the West Bank, Jordan, and Lebanon and Syria too. And we have continued campaigning hard against the Economic Activity of Public Bodies Bill, which targets BDS and is intended to restrict ethical procurement and investment, including Unison's work calling for funds in the local government pension scheme to divest from companies on the UN list of business enterprises involved with the settlements. Unison has always played an important role in the campaign for Palestinian rights, and it's never been needed more than now, at a time when the International Criminal Court Chief Prosecutor has issued, now I believe, an arrest warrants for Israel's Prime Minister Benjamin Netanyahu and Hamas leaders in Gaza for alleged war crimes and crimes against humanity. And the International Court of Justice has ordered governments to take immediate and effective measures to prevent genocide. It's particularly important we all continue to speak out and put pressure on the government to finally take action. It is really important to recognise the UK students, and after visiting SOAS and UCL encampments last week, it's nothing short of inspiration. In US, we witness arrests and expulsion with the students and the supporting teachers, professors facing extreme violence from the police and state troopers, and it's shocking that the college management are outraged by their protests and not outraged by the killing in Gaza. We are outraged that our government continues arming Israel with money that could be spent on healthcare and public services that is much needed here in the UK. It's important that the trade unions, all trade unions, unite, and that we show our solidarity for Palestinians and go on these marches. As it was said before, solidarity isn't just a word, it's what you do. You go on marches, you demonstrate, you take your union banners, and in our workplaces we also demonstrate solidarity with Palestinians to resist and to pressure for a ceasefire, help build confidence of our union members to speak up at work and campaign to divest our institutions. Unison's work will continue, and we are committed to working with the PSC. Solidarity to all. Thank you.
Thanks so much, Libby. What a fantastic contribution to start us off. You gave a very clear picture of the situation on the ground, and we know, because we are all seeing and hearing it every day, live streamed across our screens, and we know the suffering that is happening. So, and we really want to thank Unison for your support of PSC, thank you personally for always turning up to our marches and for speaking out on behalf of the Palestinian people and for supporting this event tonight. We really appreciate it. Thank you so much, Libby. We also want to thank the Public Services International for their assistance with this event. PSI is a global union federation of more than 700 trade unions representing workers in public services, including those who work in social services, healthcare, and municipal services. So we are going to show a short video from PSI, which was produced about 2 months ago, giving an update about their members in Gaza. So we're going to just see that now.
PSI members are doing all they can to save lives, but the job is getting harder. We're beginning to see children dying daily of malnutrition, and the World Bank has projected that famine could happen any time between now and mid-May. The following testimonies from our colleagues on the ground speak to the daunting challenges they face. We think their voices must be heard.
الاستهداف للمؤسسات الصحية والعاملين الصحيين ولا الإمكانيات الصحية ترتب عليه عجز بمنظومة القطاع الصحي، عدم قدرة العاملين الصحيين على القيام بواجباتهم، شعورهم بالعجز الأداء بمهاماتهم الوظيفية لخدمة أبناء شعبهم من أمراض، من مرضى ومن مصابين. أكثر من 340 من العاملين في المؤسسات الصحية تم استشهادهم، أكثر من 99 من العاملين الصحيين تم اعتقالهم، ناهيك عن يعني مئات الإصابات بين العاملين الصحيين، وهذا يعني بشكل يعني عجز يعني أمام المؤسسات الصحية للقيام بدورها.
مستشفى ناصر هذا يعد من آخر المستشفيات المتبقية في قطاع غزة لعلاج الشهداء لعلاج الجرحى واستقبال الشهداء والناس كمان المرضى العاديين. هذول الناس لما نزحوا برفح بالأساس فيش فيها مستشفى، رفح تحتاج لمستشفى، وكنا قبل العدوان وإحنا بنناشد إنه إحنا بدنا مستشفى لرفح عشان فيش مستشفى رفح، فبالك في ظل العدوان وفي ظل حرب الإبادة ينزح 1,500,000 في بلدنا فيش فيها أصلا مستشفى، فيش إسعافات، فيش مدارس، فيش جامعات. يعني أنت قدام مستقبل يعني للأسف بدك أكثر من عشرات السنين عبال ما تستعيد غزة عافيتها.
In December, the World Health Organization held an emergency meeting on Gaza. Gaza is now the most dangerous place on earth to practice medicine. More than 150 United Nations staff have also been killed, the largest death toll in a conflict in the organisation's 78-year history. As the Global Union Federation representing healthcare workers at the WHO, we made sure the voice of Gaza's health staff was heard by world leaders.
Public Services International.
PSI affiliates represent health workers in Gaza. Their leader is sheltering with his family in a church that is being bombed and is without water, food, medication, and reliable communication. They have asked us to urge member states to urgently, 1, ensure an immediate ceasefire and work to stop the war. 2, restore health sector infrastructure. 3, provide modern equipment and assistance to extract the dead and injured from the rubble. 4, allow field hospitals and humanitarian aid to enter Gaza. Palestinians have a right to live and work in safety. We urge you to heed their call.
وضعنا سيء جدا جدا هون، وكلياتنا فيش عندنا فرشات ولا في عندنا شيء، كلياتنا مريضين، يعني بس صغير مريض والكبير مريض اليوم. يلتقي معهم انفلونزات، امراض جلديه، امراض ايش؟ مش متوفر كثير ادويه، كبير هذا مستوصف كبير يقول لنا مش موجود الدواء.
احنا في رفح معظم علاجات مش متوفره بالمره، اللي بنعاني كلابنا الواحد ما بيتعب بيلاقيهوش، الطفل لما بيسخن بنلاقيش عندهم متوفر، اما معظم العلاجات مش متوفره بالمره. يعني في غزه متدمرين وهون متدمرين، بتمنى من الله نخلص الحرب. ابني اللي تعبان من ريال مش لاقي علاج له بالمره، ولا اذا بدك تجيب حلو مش بنلاقي له. الوباء، الفيروسات اللي منتشره تشهن في المخيم والمكان، يعني لازم بدنا نظافه، بدنا كاميرات تنظيف.
كالأدوية معظمها موجودة، كنا نحاول نغطي الكل بالأعداد اللازمة بالأعداد الكافية، ولكن من طلبية لطلبية حتى المدة صارت تتباعد. كمية الأدوية صارت تيجي كمية، إن كان يجي مثلا 70% صار يجي 20% منها. صار عندنا كمية أدوية محتاجة كدواء الفلونزا، كدواء القحة. هدول الأشياء كانت موجودة بوفرة. الحين كل المجتمع بيعاني مع الجو، مع الاكتظاظ، مع الخيم والمخيمات.
الحاجة دعت إلى إيجاد بدائل في ظل يعني عجز المنظومة والمؤسسات الصحية عن القيام بأدوارها، إنه بدينا إحنا كنقابة خدمات صحية بالتعاون مع نقابة الأخصائيين الاجتماعيين لعمل نقاط طبية، سواء تقدم الرعاية الأولية وإسعافات عبر خيم صحية مناسبة، أو تقدم التدخلات الدعم النفسي والمساعدة النفسية. وحنركز إنه يكون عندنا 10 نقاط صحية في خيم منتشرة على مستوى أماكن النزوح، رصد كافة الانتهاكات اللي بتتعارض مع المنظومة الصحية العالمية وتتعارض مع القوانين الدولية اللي تعتبر انتهاكات صارخة بيقوم فيها جيش الاحتلال الإسرائيلي ضد القطاع الصحي.
I'm sure you are as shocked by those images as I am, and that was 2 months ago, and we know that the situation continues to deteriorate, so I'm sure that the situation on the ground is even worse now. And we heard in the ICJ ruling some shocking statistics around 10 children a day facing an amputation with no anaesthetic, and more recently we've heard that children now are so malnourished and so dehydrated, they're no longer able to even cry. So we know the impact that all of this is having, particularly on young people in Gaza, who are over around 50% of the population. So we have to keep speaking out and keep raising awareness. Our next speaker, I'm very pleased to introduce, is Daria Safadi. She's the president of the Health Workers Union in the occupied West Bank in Palestine. She's also the women's officer in the General Union of Health Services and responsible for the health insurance department in the General Federation of Palestinian Trade Unions. I know, Daria, you are joining us from Nablus. I know Nablus has been targeted very heavily over the past few months. I know there's been huge increase in attacks across the West Bank. So we send absolute solidarity to you and all of our friends in Nablus. And we are really looking forward to hearing from you. And thank you for giving up your time to joining us this evening.
Thank you.
Okay, you can speak when you're ready.
مرحبا للجميع.
Good morning to you all. Good evening.
نقابة اليونيسون.
I would like to thank Unison for this meeting and for giving us the opportunity to talk about the health care situation that is now diminished in Palestine. Civilians in Gaza have few healthcare options under evacuation orders and intense bombardment. The comprehensive attack launched by the Israeli forces on the Gaza Strip led to a radical reduction in health and medical care options. Concerning the safe sites where organizations can provide care, they are almost non-existent. The continuous evacuation orders and attacks on health facilities forces organizations such as Doctors Without borders to evacuate hospitals and leave patients repeatedly. In this regard, the options for providing vital medical care are diminishing, while the needs are increasing at an enormous pace. As the attack on Gaza progresses, several health facilities in northern Gaza and the central region must be evacuated. Hospitals are out of service, one hospital after another, leaving the injured untreated. The healthcare system has collapsed, and reports indicate that 13 out of 36 hospitals continue to operate partially. Only 9 of them in the south and 4 in the north, while the 2 main hospitals in southern Gaza are receiving 3 times their capacity, while facing a run out of fuel and basic supplies, mainly in the medical facilities and surrounding areas that are bombarded and where evacuation orders were imposed in various parts of Gaza, especially in the north, which made access to healthcare in a very dangerous situation. This pattern has now been repeated in the south, which has 5 times its pre-war population and fewer facilities now to provide healthcare to the population. Every day we have new crimes, and the damage of the infrastructure in Gaza amounted to $18.5 billion, and many reports stated that restoring Gaza to its previous state would take 70 years. 52 martyrs were recovered from 7 mass graves inside hospitals, and the hospitals are directly targeted so as medical staff. The bodies of children, women, and men martyred in the Gaza and the bombardment and the killing remain under the rubble. Unfortunately, children are dying due to hunger, mainly because the powder milk is not provided and people are killed by starvation. 90% of children under the age of 5 in Gaza suffer from 1 or more infectious diseases, according to a report issued by UNICEF, another by the World Health Organization and the World Food Program. 3 out of 4 people drink from contaminated water sources. 1 toilet for every 800 people and 1 shower unit for every 4,500 people. Spoiled corn, animal feed, tree leaves, tree herbs, spoiled potatoes, and spoiled meat are the food of the people, and contaminated meat and food are the food of the people of Gaza. 11,000 people cannot travel for treatment, and 10,000 cancer patients face the risk of death. 700,000 people are infected with infectious diseases as a result of the displacement, and 8,000 cases has hepatitis. 350,000 suffer from chronic disease and are at risk because we don't have medication. As for women, 60,000 pregnant women among the displaced in Rafah, south of the Gaza Strip, are about to give birth, awaiting their unknown fate after the Israeli occupation threatened to destroy Rafah. Women are forced to shave, unfortunately, due to health concerns as a result of the lack of water to wash, to have shower, and they are having increasing suffering during their periods. 2 mothers are killed every hour, and more than 10,000 women are killed, and about 19,000 others are injured as a result of the war in Gaza. 37 children lose their mother every day, in addition to 155,000 pregnant and breastfeeding women in Gaza facing extreme difficulty in order to obtain water and healthcare, etc. In the West Bank, we have repeated invasions. I am very sorry as well, because I greeted Unison, and I'm sorry.
لأنها هي حملة التضامن مع الشعب الفلسطيني.
especially that we are
الفلسطيني. فعذرا على الخطأ.
So I mentioned UNICEF while I should have mentioned Unison. I'm very sorry for the mistake. I continue my speech. Unfortunately, children are suffering a lot in Gaza and in the West Bank. Invasions for cities such as Jerusalem, Nablus, Ramallah, Jenin, Tulkam, Hebron, Tulbas, Palkimia, and all governorates suffered and the civilians were targeted, unfortunately. 540 martyrs in the West Bank and thousands of homes were destroyed in West Bank. More than 470 buildings were destroyed in the West Bank. Moving from a region to another in the West Bank is very dangerous, mainly because of the measures implemented at checkpoints and blocking regions and cities, pushing people to resort to secondary roads that are very dangerous. You will need 50 minutes from Nablus to Ramallah, but now, due to the measures imposed by the Israelis and the closures and the many checkpoints, you will need a minimum of 3 hours to arrive. Al-Malik Hussein Bridge is the only road for 3.5 million Palestinians to travel, and only opening 3 hours per day and closing totally on Saturday. The Israeli police is going after the workers in Palestine and coordinating with some Palestinian and Israeli employers. Measures are being very degrading for the Palestinian workers. And the General Union of Health Services in Palestine opened a hotline in order to work, to help the workers. Unfortunately, as well, a lot of martyrs fell during among health providers in ambulances. And unfortunately, the lack of fuel is creating a very serious situation. As I've mentioned, 330 hospitals were closed and ambulances were destroyed. The General Union of Health Services in Palestine asked for the following. First, a ceasefire, an immediate ceasefire. It is unacceptable to continue that way and to consider Gaza separate from the Palestinian state, and we ask to stop the blockade on medical facilities and provide access to healthcare and as well access to medication and treatment. And we ask as well the powerful states to help us and to let the aid assistance enter to Gaza. Thank you so much.
Thank you so much, Daria. That was really powerful to hear your testimony from there in Palestine. And as I said, our solidarity to you and all Palestinians. We know how difficult things are at the moment, and we will continue to do all we can, not only to amplify your voices here, but to take action too. And I think that's a very important thing for us to do as trade unionists. And we should all make sure that we, look at the calls from the Palestinian trade union movement. They've been very clear. They do want us to obviously be putting as much pressure on as we can to call for an immediate and permanent ceasefire and for aid to be allowed in. And obviously at the moment, the work we are doing, trying to halt arms sales is essential as well. And those are things that you can raise within your trade unions, raise motions through your trade union branches, put pressure on the leadership of your union to take that up and raise that. But obviously, we also want as many people out on the streets as possible. And I know Celia will be talking about that shortly, the pushbacks against us, but people do need to get trade union banners, flags, and get, your membership out onto the streets campaigning when we've got national action, but also when we've got local action. A lot of our local action that we are calling is based around the boycott, divestment and sanctions campaign. So obviously Barclays Bank is one of our key targets at the moment. There are regular days of actions and calls for people to close their bank accounts there and contact the bank about why they are doing that. But also it gives us an opportunity to talk to the public and keep raising awareness about what is happening. We know that the public, there's mass support for a ceasefire. The majority of the public here think that there should be a ceasefire, and they also the majority of the public here think that we should be suspending arms sales to Israel. So do keep raising this in your trade union, keep talking to members about what is happening, keep sharing actions with them, and when there's a workplace day of action, try and make sure you carry out some action within your workplace, be it wearing Palestinian badges, flags, having a fundraiser for medical aid for Palestinians, or other organizations that are helping directly on the ground in Palestine at the moment. But also, most importantly, really talking to your colleagues and making sure people understand the importance of our collective voice at the moment for the Palestinian people. I'm going to hand over to our next speaker now. Celia Hansen is our campaigns officer at PSC. She's the main officer dealing with protecting the space at the moment and the pushback against and the increased attacks on our movement. As for example, we've got the anti-boycott bill, which is currently in Parliament. And obviously now with tonight's announcement of a general election, we'll have to think carefully about what we are doing in terms of that, because there will be this short period of time when the government is going to be trying to push through bills. So the more pressure we can put on our MPs now to make sure that they don't support that bill, the better really in this short period that we have. But also she will talk about other campaigns, I'm sure. And we know, as I say, that there is a huge attack on our movement, and it is important that we push back against that. We have the right to protest. And as I said at the start, our protests are peaceful. They're for justice and peace. They're not hate marches. So thanks so much for being with us, Celia. I'll hand over to you.
Thanks, Louise. Hi, everyone. Yeah, as Louise described, my role at PSC is focused on protecting and expanding the space that we have to campaign for Palestinian rights in Britain. It's been quite a few days, this past couple of days. Rishi Sunak has just called the general election on the 4th of July. And, in the next few weeks and beyond, we'll be announcing and running campaigns to lobby all political parties, including their leaders and candidates, to support Palestine. We're going to make Palestine an issue in this general election like never before. Yesterday we saw the International Criminal Court seek arrest warrants for Netanyahu and Gallant, and this decision carries significant implications for the British government, who are trying to justify continuing to arm Israel's genocide. We've heard from the incredible lineup of speakers this evening the unconscionable violence that Israel is continuing to unleash on the Palestinian people, and what this has done to devastate the health system there. Our Palestinian partners, including trade unionists, have asked us to keep pushing the government to uphold international law by demanding an immediate ceasefire and an immediate end to arms trade with Israel. And this is what we've been calling for, since October in our extraordinary mobilizations. Libby from Unison, who you heard from earlier, has marched and spoken at pretty much every demo we've had, sharing our platform with many other trade unionists. And like Louise described, last Saturday, the trade union bloc marched with us again, this time with over 250,000 people, to commemorate the ongoing Nakba, highlighting the root causes of today, but also celebrating 76 years of Palestinian resistance and victory over Erasure. And these demos are one of the most palpable displays of enduring solidarity as we continue to build a popular mass movement in Britain for peace and justice for the Palestinian people. But really, they represent only the tip of the iceberg of our solidarity work, which trade unions here are completely vital to. So yeah, I've been particularly focused on our Right to Boycott campaign, which has mobilised a coalition of over 70 civil society organisations to oppose the government's anti-boycott bill. If this is passed, the egregious bill will ban public bodies from partaking in boycotts or divesting from companies or countries that are committing human rights abuses. And its principal target is the movement for boycott, divestment and sanctions in support of Palestinian rights. Had this legislation been in place in the 80s, it would have banned similar BDS campaigns, which helped put an end to apartheid in South Africa, and these campaigns that British trade unions have a very proud history of supporting. So from the start, working on the right to boycott, Unison have been a really key partner in our parliamentary lobbying. They've been an essential part of our briefings to MPs and have provided evidence on the dangers of the bill to the House of Commons, along with the TUC. We've also, with help from PSC's Trade Union Advisory Council, a successful motion was passed at TU Congress last year, which reaffirmed its support for BDS and opposition to this bill. So yeah, at the moment the bill is in the House of Lords, but now the general election has been called. It's vital that we rally together to lobby and pressurise Parliament again. And we'd encourage unions to keep inviting PSC speakers to conferences, to branch meetings, and to keep submitting motions and supporting the cause from our Palestinian partners, especially now. Another area of our work that the bill would target is, the inspiring students who have set up 33 encampments across Britain that PSC is actively supporting, and who are demanding that their universities divest from companies complicit in Israel's genocide. We've already seen Trinity College, Cambridge, and the University of York agree to divest from all arms companies, and UCU branches and other unions on campus across the board have been really fantastic. Holding solidarity rallies, bringing food and materials to the encampments, and would encourage unions to keep sending, delegations to visit these encampments in local areas, take banners and resources and really amplify this on social media as well. At the moment, we're running a major boycott campaign against Barclays Bank as part of our Stop Bombing Israel campaign. Barclays, once again, are on the wrong side of history, and new research we published exposes that they've actually increased their financing of companies whose weapons, components, military technology are being used by Israel in its attacks on Palestinians. The link to this compelling report, if you want to read it, which you definitely should, is in the comments for you to read. But yeah, amongst other actions in this campaign, we run account and closure days, which have led so far to 2,500 people closing their accounts. And the next one of these is on the 11th of July. So, this is something that you can really easily share with members using the link again that will be in the comments. We really want as many people as possible closing their accounts. And we've also created a trade union, a model trade union motion on this campaign, which we can circulate. And this brings me on to kind of more ways that you can get involved to keep building this mass movement, which is really capable of tackling our government's shameful complicity, especially now. We regularly send e-actions, and you can sign up to PSC for free to get these updates, together with other actions that you can take, which are in our weekly emails. Trade union member power is really crucial to a lot of our campaigns and pressure building. So raising awareness amongst members and getting them to join PSC is really key. Workplace days of actions are great for this, like Louise mentioned, and we can provide more information on this if you want, and kind of resources to support you with this. Also, sponsoring or attending events and meetings in support of Palestine in your local area is really helpful to help expand links between PSC branches, union branches, and local trades councils, which is very important. We already have 15 national trade unions affiliated to PSC, and if yours isn't, change that. And also make sure that regional and local branches are affiliated too. Again, there'll be a link in the comments on how to do this, which is on our website, but again, we can help. So yeah, this has been quite a sort of a whistle-stop tour of some of what we're doing right at the moment. And I think, yeah, I'd like to just end by noting that people are awake in a way that they haven't been before, and the narrative is changing. I think in these failed attempts to smear us, our movement only becomes more and more galvanized as we continue united in our millions to fight for Palestinian freedom, justice, and equality. Thank you.
Thanks so much, Celia. That was a really good roundup of what we are doing and what actions are available. I think, as you've said, it is vitally important that people do contact their MPs about the anti-boycott bill, given the calling of the election tonight, because I think there will be an attempt to try and do some, to push that through. So it's really important we really keep the pressure on about that. And thanks for raising about students. And for any of you on the call that haven't been to a student encampment, there are now loads of them up and down the country, and it's very it's just very empowering to go spend time with the students. They're very peaceful, despite what is being said about them. Again, people make these statements, but if you go along, you'll see the ones I've been to. They've had arts activities, they've had music. Take some food if you go. They're always very appreciative of a bit of extra food, but do get along and show your solidarity to them, because as I say, there are attempts to demonize them as well. I'm just going to say a massive thank you to all of our speakers, because they've all been amazing. It's been a really good meeting tonight. I've just got a few things to sum up with. Again, Celia's gone through the Barclays Bank campaign, but please do go on to our website and share the link. Close your account if you've got an account with them. Encourage your friends to close their accounts if they've got an account. And Celia did mention you can sign up for all of our e-actions, and there are going to be more now, particularly with the general election being called. You don't have to pay to do that. You can just go onto the website, sign up for to get the updates about all of the e-actions that we are taking. Please continue to do all you can to support Palestine Solidarity Campaign. We need to keep growing our movement. We've grown massively since October, but we need to continue to do that and to continue to strengthen our movement. If your trade union branch isn't affiliated to PSC, please do make sure that it is. Take a motion to your branch, and we can give you a model motion just to take to your branch to get them to affiliate. And as has been said, if you want a speaker to come along, do reach out. We'll be more than happy to provide you with speakers at local events. And I would encourage each and every one of you to become a PSC member as an individual if you're not already. We're a huge organisation, as I said at the start. We're the biggest organisation across Europe now campaigning for Palestinian rights. And I'll end with this. Obviously our call at the moment, and the call, what our Palestinian friends are asking for, is for us to continue to push and fight for a permanent and lasting ceasefire and for humanitarian aid. And that is absolutely essential with what we are witnessing every day. However, we know in our movement that this did not begin on the 7th of October, that Palestinians have suffered decades of oppression and dispossession. And our job as the movement, the Solidarity Movement, is to continue to campaign. Once we get a ceasefire, it's to make sure we are still out on the streets, still campaigning, still fighting until we get a long-term peace and justice for the Palestinian people. So thank you very much for attending. Looking forward to seeing you all on the streets at the next demo. And solidarity.